diagnose the celiac disease, and what's the gold standard method to diagnose?
Today we are shooting this video sitting at Jalandhar in the heart of Punjab, and celiac disease is a very common problem in this part of the country. Rather, I will say one of the highest incidence of celiac disease is there in Punjab, and it can occur at any age group. Usually the most common presentation of this celiac disease is at younger age groups starting from 1 year, 3 year, 5 year, but we have diagnosed people both male and female even at the age of 50 and even 60 also. So celiac disease basically is a disease where we have the patient is allergic or patient gets disease symptoms or anemia or diarrhea or weight loss, all of malabsorption because of the consumption of wheat, and more specifically because of the consumption of a protein known as gluten, which is there in wheat, rye and barley. So the culprit here is gluten, and in these patients, because of genetic modifications occurring over the years by consuming wheats by their ancestors, they become intolerant to this gluten. The gluten damages their villi and the surface of their small bowel, including duodenum and jejunum. Thereafter, the disease process starts. So the patient, the child, the adult can commonly present with low hemoglobin, that is anemia. They can present with inability to gain weight, they are basically thin, indigestion of food. They can present with osteoporosis, they can present with infertility, with chronic diarrhea, that is 7 to 8 stools, watery stools per day, and even skin lesions. So the presentation can be vast, and we need to keep this entity in mind whenever we see these patients, and always rule out, especially in areas where celiac disease is quite endemic.
So what's the gold standard method to diagnose the celiac?
Yes. We take some blood samples, which includes tissue transglutaminase, that is a sample known as IgA tTG. Then we have modified blood testing like IgA DGPs, and then we have EMAs testings, and then we have genetic testing also for these patients like HLA DQ2 and DQ8, which can tell us which patient are predisposed to having celiac maybe in this lifetime. And the gold standard still will be a biopsy test, which we do by doing an upper GI endoscopy to a suspected patient. We go into the duodenum of the patient and take small bites of tissue from the duodenum folds, and then these tissues are sent to the pathologist to understand whether the patient has features suggestive of celiac disease. And we have very nice pathological scoring system which gives us a confirmatory test whether our patient has celiac disease. And then the remedy is quite simple. The moment we prove and we label the patient as celiac disease, most of the time the only treatment needed is that the patient should eliminate all kind of wheat and even that is gluten from his diet and go to a complete gluten-free diet for the lifetime.